Bloody hospitals and dying patients were common before antiseptic surgery was discovered. Joseph Lister was a British surgeon from Upton, Essex. He was born in 1827, and he created antiseptic surgery. Antiseptic surgery is when antibiotics are used on wounds to prevent infection in or from a surgery. Joseph Lister broke barriers in history and medicine because of his discovery of antiseptic surgery. Joseph Lister had been interested in science since boyhood and was trained by his father, Joseph Jackson Lister, to use microscopes, which he used to study microscopic fungi and other botanical specimens. Following Hodgkin's recommendation, he avoided apprenticeship as a surgeon before attending medical school, and instead he studied for an arts degree. Between 1844 and 1847, Lister attended the University College of University London, and in 1846, he watched a celebrated surgeon, Robert Liston, perform the first surgical operation in Europe under ether anesthesia. After graduating, he went to study under a well-known surgeon, James Syme, in Edinburgh. He prospered in Edinburgh and married Syme's eldest daughter, Agnes. He spent the next 7 years lecturing, operating, and engaging in research. At 33 years of age, Lister was appointed Regius Professor of Surgery at the University of Glasgow, which had twice the population of Edinburgh. Lister was interested in wound healing, and he began working as a dresser for Sir Erichsen. Erichsen believed that wound infections were caused by germs from the wound itself that became concentrated in the air. Lister was not convinced, and he suspected infections were caused by something in the wound itself. In 1864, Lister read one of Louis Pasteur's papers, which showed him that fermentation and putrefaction were caused by living particles floating in the air and settling down on surrounding objects. In the 1800s, surgeries were unsanitary and wounds would get infected from the germs, and the patient would most likely die from the surgery. After reading Pasteur's paper, Lister thought destroying the organisms that created surgical infections would prevent it. For his first patient, one with a compound fracture of the leg, he used carbolic acid, used to clean up a sewage plant on the wound. He poured some carbolic acid on the wound and mixed it with the blood to create a paste. He covered the wound and added fresh carbolic acid to it every day. The patient was able to recover with no infection, proving that carbolic acid could stop a wound infection. From 1865 to 1867, he treated 11 cases, and 9 of them healed without infection. After 1870, Lister also used absorbent gauze with other antiseptic substances. He also experimented with the carbolic acid spray to purify the air, but he abandoned it when he realized that pathogenic organisms were not plentiful in the air. His staff and people who had studied the details of his technique highly praised it, but London was still quite skeptical. In 1877, he became Professor of Surgery at King's College Hospital in London to promote his method, but the surgeons were not impressed or persuaded. The nurses and surgeons were grumpy and difficult to deal with, but Lister succeeded in converting them to his method, and his reputation grew. In 1883, Queen Victoria made him a baronet and elevated him to baron status. By 1890, the whole world had accepted Lister's discovery of antiseptic surgery. In the 1800s, before antiseptic surgery, people thought wounds could get infected from small germs that could cause contagious diseases, but no one thought to associate it with wound infections. Beds and coats were not washed after surgery, and surgical equipment were washed only when they were put into storage. The uncleanliness caused infections, and most people who went through surgery died from an infection or blood loss. Joseph Lister changed that by discovering that cleaning the wound and cleaning the surgical tools would prevent wound infections. Before the antiseptic period, 16 out of 35 people died from surgery, but after antiseptic surgery, 6 out of 40 people died from surgery. The death rate went down from 45% to 15%, which means the death rate reduced by 30%. Today, hospitals are clean and the wounds are kept from infection because tools and beds are washed. People who take surgeries do not have a high chance of dying, and surgery is safer and cleaner. Your surgery has been successfully completed.
Oh, thank you, sir.
Okay, come here every day so I can reapply the carbonic acid to your wounds until they are finally cleared.
Okay.
There are many interesting things about Joseph Lister other than his work. Growing up, Joseph Lister thought about being a priest instead of a surgeon, but his father encouraged him to stay in medicine. And one of his most famous patients was Queen Victoria, who had sprouted an orange-sized abscess in her armpit. And the popular mouthwash brand, Listerine, was named after Joseph Lister and was created by American physician Joseph Lawrence. Joseph Lister was a British surgeon who saved many lives and accomplished many things in science and medicine. Before 1865, surgeries were risky, unsanitary, and most people died from surgeries. Discovering antiseptic surgery, Joseph Lister found a way to make surgeries safer and cleaner, breaking barriers in history and medicine by using antiseptics that reduced death rates from surgeries. Surgeries today are sanitary and save more lives due to surgeons using antiseptic surgery.